Through the HITECH Act, the federal government is making a major investment in encouraging clinicians to use health information technology to improve quality of care. The regional extension centers have been tasked with assisting primary care providers in achieving the requirements of meaningful use through certified electronic health records. This video demonstration, created by the Iowa Telligen Regional Extension Center, was designed to provide a better understanding of how you can implement meaningful use measures into your everyday workflow in an efficient way, improving healthcare delivery to your patients.
Hi, I'm Candace Kane. I have an appointment with Dr. Welby.
Good morning, Candace. How are you doing today?
Not so well.
Oh, I'm sorry to hear that. May I see a copy of your insurance card, please? I'd like to verify it.
Sure.
Thank you. I see you have a $10 copay. I'd like to collect that at this point, please. Back to you.
Okay.
Thank you. I'll get you a receipt here. There you go. And Candace, we are updating our system at this point, and we're doing everything in the computer now. So I'm going to hand you this little tablet, and if you could fill out all the information and sign at the bottom. We have a new regulation for the government. We need to have you put in your race, gender, ethnicity, and preferred language. So if you'd like to have a seat and do that.
Okay.
Thank you.
In this scene, you see how efficiently the core meaningful use measure record patient demographics, date of birth, gender, race, ethnicity, preferred language, are captured and documented as structured data. Structured data allows it to be reportable. You can pull an accurate report to track the data for meaningful use attestation.
There you go.
Thank you. If you just have a seat, the nurse will be with you shortly.
Okay.
The EHR provides an easy way to track the patient's location throughout the clinic visit.
Candace?
Yes.
Oh, good morning, Candace.
Good morning.
Not feeling so hot today?
Not so well.
Okay. Well, come on back. Follow me. Let's get a quick weight on you. It looks like we did your height when you were here before, so we can skip that. And then I'll take you back to the room.
Okay.
So just step up on the scale. Okay. Okay, Candace. Just have a seat on the table. Okay. I'll pull up your chart here and then take your vitals.
Okay.
Okay, in pulling up your chart, it looks like you're due for a mammogram, Candace. When I opened your chart, I received an alert saying that you were past due. The last mammogram I had recorded in our chart is from October 2009. Have you had one since then?
I have had it done. I have my female exam and my mammogram done through my gynecologist. And I just had that done in March and everything was okay.
Oh, good, good. I'm glad to hear that. Okay, would you please ask them to send a copy of it to us? We like to make sure that our patients stay current on all their preventative measures.
Sure.
Okay, so right now I'm going to take your vitals and then get that documented quickly here. Okay, your blood pressure looks good, Candace.
As part of Nurse K's routine workflow, she has already captured 2 core meaningful use measures. The mammogram alerts satisfy the clinical decision support rule, and by documenting the vital signs in the patient's chart as structured data, it now resides in a fixed field that can be easily identified for reporting.
Okay, so I'll just document your vital signs in your chart here quickly. Okay, next I'd like to update your medication list and your allergies.
Notice the EHR alerts Nurse K of the patient's allergy to penicillin.
Looks like you're allergic to penicillin, is that correct?
I am. I break out in hives.
Okay. Do you have any other allergies?
Not that I know of.
Okay. I see in your chart that you currently take Celebrex 200 milligrams daily and calcium 600 milligrams twice a day. Are those medications still current?
Yes, now the Celebrex for my knee pain, I don't think is helping.
Oh, really? Okay. I will add that concern for Dr. Welby to address today. Are you on any other medications or over-the-counter things?
No.
Okay.
While visiting with Candace about her allergies and current medications, Nurse K has addressed two core measures: maintain active medication list and allergy list. Again, each is entered as structured data. The nurse then performs medication reconciliation by clicking on the appropriate Reviewed button. This allows for menu measure to be met.
It looks like we updated your medical history at your physical last summer and you're a pack-a-day smoker, Candace. Have you been working on trying to quit or reduce this?
I have. I've cut back with the information that Dr. Welby gave me last
good.
time. I'm down to a half a pack a day.
Oh, that's a good start, Candace. I'll make those changes in your chart here.
The patient's smoking status has been documented as structured data, satisfying the Record Smoking Status core measure. Also addressed in this scene is one of the clinical quality measures. Previously, Dr. Welby chose the NQF measure preventive care and screening measure pair, which includes tobacco use assessment and cessation intervention as one of his 6 CQM. At the previous visit, Candace's smoking status and patient education were documented. By following up on the smoking status at today's visit, they have now satisfied the criteria needed on this patient for meeting this CQM.
Okay, Candace, what is your main complaint today?
Well, I've had a cold and I've had a cough and a runny nose, but the last couple of days I've had a sore throat and it hurts so much I can hardly swallow.
Oh no. Have you been exposed to anyone with strep throat?
Not that I know of, but I'm a preschool teacher and I get exposed to everything.
Okay. Well, we've been seeing some strep throat lately, so I want to get a swab of your throat for a strep test. Okay, say Okay. I'll take this down to the lab and Dr. Welby will be in with you shortly, Candace.
Okay.
Oh, hello.
Hey,
How's your morning going?
Great. How about you?
Pretty busy, but I have a strep test for Dr. Welby's patient in room 3.
Okay, I'll get right on this. It should be in the computer in just a few minutes.
Awesome. Thank you.
The strep test is positive and documented as structured data. In meaningful use menu measure incorporate clinical lab results. All lab tests whose results are expressed in a positive, negative format or as a number must be reported on to satisfy the measure.
Morning, Candace.
Hi, Dr. Welby.
Kate tells me you get your smoking down to half a pack a day.
I did. The information that you gave me about lung cancer scared me.
Okay, well, I'm glad that information was helpful. It looks like you have that summer cold that's going around. Your strep test came back positive. So let's take a look inside your throat. Yep, that looks pretty bad. We're going to have to get you some medicine. I'm going to check your lungs too while we're at it. Then take a deep breath. One more. Okay, well your lungs are clear.
Oh, by the way, the last time I was in, you gave me Celebrex for my knee pain.
Okay.
I don't think it's helping. You thought maybe there would be something else we could do?
Okay, yeah. Well, I'll have the nurse schedule an appointment with the ortho doc in town. I'll get you a copy of your X-ray, and I'll send the MRI and other information to them as well. Let me go ahead and update the problems in your chart.
Dr. Welby is updating Candace's problem list by demoting any problems that no longer exist, such as kidney stones, then moving her current problems, knee pain, and strep pharyngitis, to the top of the list. By doing so, he meets the meaningful use measure, maintain up-to-date problem list. With this vendor, Dr. Welby must click on the Review button to consolidate this for the measure report.
Okay, let's go ahead and get some antibiotics ordered for you.
Okay. Remember, I'm allergic to penicillin. I break out in hives.
Okay, yep, your chart is alerting me of that, so I'm gonna go ahead and prescribe you Zithromax.
Okay.
Do you still use the Walgreens in Clive?
Mhm.
Okay. Well, Zithromax is pretty expensive, so let me make sure that your insurance will cover that.
Oh, thanks. I appreciate that.
While ordering a prescription through his orders module and transmitting the prescription via the internet, Dr. Welby is meeting two core measures, CPOE and e-prescribing. There are multiple behind-the-scenes measures occurring with e-prescribing. When the drug interaction and formulary functions are enabled, the EHR systems automatically generate and indicate in real-time notifications at the POC for drug, and drug allergy contraindications. Also, the EHR pharmaceutical data will be used to check a medication against the insurance company formulary to ensure compliance with evidence-based guidance and prevent extra cost to the patient by suggesting formulary alternatives. By simply e-prescribing this patient's prescription, Dr. Welby just captured 4 meaningful use measures.
Okay, well, you should feel better in about 3 to 4 days. If not, give us a call. I'll have Kay come in and give you a pamphlet with that information to help you get through that last half a pack. Okay?
Okay.
Is there anything else I can do for you?
I think that's it.
Okay, have a good day.
Thanks, Dr. Welby.
As Dr. Welby was documenting his HPI and notes, he alerted the nurse to schedule this referral appointment for Candace. It is office policy that the specialist be provided pertinent patient history for all referrals. Therefore, Kay has prepared an electronic copy of records significant to the knee problem for the patient to take to the specialist appointment. To satisfy the summary of care menu measure, these records can be in any format, electronic, printed, or via a portal. Also satisfied at this time was the patient education measure with smoking education materials.
Okay, Candace. I've made an appointment with the specialist, so that's your date and time for that. And I have an electronic copy of your health information here pertinent to the knee pain. So you can take that with you to the visit
Okay.
with the specialist. And also, Dr. Welby wanted you to have this pamphlet on the new medication to help you quit smoking. And we're seeing a lot of success with it, so hopefully that will help you. Okay, when you check out, Pollyanna will have a visit summary for you at the desk. And be sure to pick that up in case you have any questions about today's visit. Then that will be a summary for you. Take care, and I hope you're feeling better soon.
Okay, thank you.
While concluding his notes, Dr. Welby documented that the patient education pamphlet on smoking cessation was provided. Also, an after-visit summary was generated to be made available to the patient.
Hi, Candace.
Hi.
Here's a summary of today's visit. I hope you get to feeling better soon.
Okay, thank you.
You're welcome.
By providing the after-visit summary, another core measure was met. In this typical patient scenario, Dr. Welby and his office staff have satisfied 16 meaningful use measures in a very efficient manner. This slide is a vendor-specific visual of a meaningful use dashboard. Many of the EHR vendors provide a fairly robust dashboard function. It is used to view, report, and submit measure calculation information. Most dashboards allow you to capture monthly trending of compliance to the meaningful use measures at both the individual provider level and aggregate practice level, allowing you to see the measures you are meeting and those you are not doing quite as well on.
Meaningful use is a set of criteria known as objectives that all eligible providers must report on. The purpose of this skit is to provide an example of how the 16 measures you saw today can efficiently be satisfied in your workflow without creating a great deal of additional work.